Today's presentation, Redlands in the Influenza Pandemic of 1918-1919, will be brought to you by Dr. Ann Deegan. Ann received her doctorate in textile history at the University of Maryland and minored in U.S. history, with her dissertation related to the American Civil War. She has taught at numerous universities over the last 30 years, including the University of Maryland, Kansas State University, Utah State University, and the University of Redlands, as well as the University of California at Riverside. Additionally, she has been a curator of history in private and public museums, including at the San Bernardino County Museum and Redlands, as head of the history division. She does research, writing, and publishing in the areas of U.S. history, particularly the late 19th and early 20th centuries, and has numerous publications, including co-authoring the books Early Redlands and Redlands in World War I. Thank you so much for being here today, Anne. I'll turn it over to you.
Good morning, and welcome to Redlands in the Influenza Pandemic of 1918-1919. I want to start by giving some statistics comparing the pandemic of that early 1918-1919 to today's COVID-19 deaths to put some of this in perspective. Worldwide, the flu deaths were between 25 to 50 million, and there's uncertainty in the totals because there was not great record keeping at that time. Worldwide COVID-19 deaths from about January through November 6th have now reached 1.2 million. The US lost about 675,000 flu deaths in 1918-1919. To date, to November 6th, there have been about 235,000 deaths in the United States. Something to remember, though, is that this was a time when World War I was in progress and had been going since 1914 to about November 11th, 1918. And there were 15 to 20 million soldiers and civilians that died in World War I. This is a smaller number by far than those that died of the flu at the same time period. More comparison of 1918 and 2020. Interestingly, in 1918, scientists did not know about viruses, and that's what the influenza was. Today, we do know it's the influenza A H1N1 virus, and there was no test to see if you had the disease or if you had had the disease like we have today. Although they were working on it, there was no successful vaccine at the time. There were a lot of reputable scientists that were coming out with vaccines. They even tried them on thousands of people, but in hindsight, they did not, none of them worked. One of the most important things to remember is there were no antibiotics during this time period of the flu, and secondary bacterial pneumonia killed a tremendous number of these flu deaths. And there was no intensive care and no mechanical ventilators. Different time. What was the flu like? Very quick onset, 24 to 72 hours. And in the most lethal period for this flu, people could get sick in the morning and die by the evening. So it was an extremely fast onset, extremely contagious. In a number of months, it had spread all the way around the world. Symptoms were very similar to the flu, with fever, cough, headache, fatigue. And again, the deadly part was often this bacterial bronchopneumonia. The lungs of people who died were examined in autopsies, and they found that they were so badly damaged that that's why in many cases people were turning blue. They were actually changing color to purple-black. This was a very interesting influenza pandemic also because usually the deaths occur with influenza for the very young and the elderly, not with this one. You see what they call a W-shaped curve here from the 1918 period, where a tremendous number of the deaths were in what was considered a very healthy age range from their late teens into their mid-30s. And of course, this was terrifying for people. Geographically, where did it come from? Well, there's a lot of research going on about this flu, and they're still not sure. They've come up with maybe 2 or 3 possibilities, but it's often called the Spanish influenza, but it did not originate in Spain. What happened was that particularly in Europe and the United States, there was a lot of censorship in the newspapers during World War I when this was going on. But Spain was neutral and went ahead and published about the flu. So the term Spanish influenza sticks, and you'll see that in many sources. Another unusual thing about this flu is it was in 3 waves, which wasn't the most normal thing. The first wave was from March into late summer of 1918, and it was very contagious, very quick moving, but not particularly lethal in comparison to the later waves. The next wave hit in late August through November of 1918. Again, very contagious, very fast, now lethal. And in the third wave, December 1918 to February 1919, still lethal. But I would like to mention that not every location had 3 waves. Many of them did. Some of the worst hit areas on the East Coast of the United States did not have much of a third wave, whereas the West Coast areas often had these 3 waves. The first wave, the one that was highly contagious but not as lethal, actually popped up in the United States in the middle of the country at Camp Funston in Fort Riley, Kansas. And this was a very large Army camp, training camp. There may have been other first locations. This is again something that the epidemiologists are studying. But it arrived there, then spread to many other Army camps across the United States. And because it was World War I, we think today about COVID-19, but we're not in the middle of a world war on top of that. These people were faced with the fact that they had been in war. The United States had been at war from April of 1914 and into 1918. They started with under 400,000 soldiers and finished with over 4 million. Well, those men had to be trained. They were crammed into training camps all over the United States. And they were mixing people. They were bringing people from rural areas, urban areas. We had a lot of immigrants at that time. English wasn't necessarily their first language. There was communication difficulties. Once you train at one camp, you might have been put on a train, moved to another camp or to embarkation points such as East Coast ports. And they needed a lot of doctors and nurses just for regular Army needs. And they pulled them out of civilian life. So this is the stage. This is what was going on as this first wave hits. It was wartime. There was a lot of concern about morale. You don't want to interfere with the morale. You don't want to interfere with wartime productivity. You don't want to interfere with generating large sums of money for the war. So newspapers did cooperate and didn't publish huge amounts of information on the flu pandemic, unlike today with COVID-19 when we get kind of bombarded with information. There were some, there were obituaries and death notices. They didn't always say what had caused the death, but people were getting probably pretty knowledgeable that something serious was happening, particularly when there were desperate pleas for nurses and doctors as this generates more and more deaths. At the bottom of the screen, you'll see the comment about Liberty Loan drives. There were several different Liberty Loan drives throughout World War I in this country that were generating huge sums of money for the war. And again, there was a concern, we don't want anything to interfere with that if we can help it. Second wave. This was late August through November, highly contagious and lethal. The first wave, it hit in Army camps. It was a flu epidemic. People get sick and then they get well. Not a lot of deaths. It spread over to the European War Theater. And then something started to spread back in through the United States East Coast and other places in the world. And it hit first in the Boston area in one of the naval facilities in late August, and then into the Army camp, Camp Devens, right outside of Boston. So it's coming in late August. By the end of September, there were 14,000 flu cases that had occurred at Camp Devens and 757 deaths just in the camp. The flu was also spreading into Boston itself. And then it hit Philadelphia as well. September 28th, Philadelphia already had flu in the nearby Philadelphia Naval Yard. and civilian cases in the city. But there was a Liberty Loan parade scheduled, and the Philadelphia Director of Public Health was asked by doctors, please cancel this parade, and he decided to not cancel it in order for money to be generated for the war. This is a photograph of the Liberty Loan Parade in Philadelphia. You see how crammed people are. They think over 200,000 people attended it. That was September 28th. By the second week of November, a little over a month later, there had been 12,000 deaths in Philadelphia. Really a huge number. Hospitals were overwhelmed. Doctors and nurses were not only getting ill, but they were dying. And there again is where you start seeing more and more articles in the newspaper saying, send nurses, send nurses. The second wave, this one that hit Boston, hit Philadelphia, it also hit New York City very badly. All these reports, it's coming back in. It's very lethal now. It's now spreading to mostly Army and, well, in Navy facilities as well for training all over the country. At this time, late September or very early October, there were no deaths yet in Redlands from this flu. But some Redlanders who were in the military serving at these various camps began to die. And I've listed 4 right here. And you can see September 29th, Philadelphia. October 5th on a troop transport ship. Stanley Jennings was buried at sea. Troop transport ships were notorious for being overcrowded. People would get on them. Within days, there were like an epidemic going all through the ships of the flu. Many people would die, and they'd get to Europe and discharge sometimes thousands of men into the hospitals there. Dean Nethaway was in Texas, another one in Virginia. This next slide shows 3 out of the 4 of those men, and I just happen to have their photographs. There were about 11 people from Redlands who were off serving in Army hospitals and in various camps, and they died a little later. And I just wanted to share this with you. Mabel Wellman was the one woman who died. She was a nurse in the Army hospital in the Bronx, and she died the 15th of October. But you can see by the 21st of October, it has already spread all the way over to Washington State. Well, the people in Redlands were watching this spread across the country. And you can imagine the war stress, but now you have the stress of wondering, when is it going to hit? We saw that somewhat with COVID-19. It was moving east to west. It was also coming into some of the ports, West Coast ports, like San Francisco and Los Angeles. And in the next slide after this, I'm going to show you some information from Winslow and Flagstaff and Needles, but it was going along the railroads, one town after another. And on October 8th, Winslow was so badly hit, it only had a population of about 2,500 people, and they already had 11 deaths. Then it hit Flagstaff. Then it hit Needles, and here's on October 9th. And Needles on this date had 2 doctors and no nurses, but they didn't help themselves very much by going ahead with their Liberty Loan bond drive on October 8th. They raised a lot of money, but it probably didn't do them any good for the flu. Now, October 12th, the Redlands Daily Fax said, not bad here in town. And the man that is quoted many times in the Redlands Daily Fax is Dr. William Taltavall. He was the health officer in town. Redlands was lucky. They had several very experienced doctors and nurses that did a very good job in Redlands. But October 12th, the disease was maybe 150 cases. In fact, sometimes at this point, they thought those cases could be just the normal flu. But Dr. Taltavall said, take precautions. What happened? 2 days later, this was the headline in the Redlands Daily Fax. Drastic closings ordered. What did they close? These were the community mitigation measures. They closed the public schools, kindergarten through 12th. They closed the movie theaters. They closed the churches. They said no public gatherings, including in stores. Stores had to close by 6, and they did not shut down universally like restaurants and all the businesses. They just said the movie theaters and then closed by 6 for the others. A little aside, Chief of Police George Larmore and his officers had to enforce this. And George Larmore, by December, had a very bad case of the flu and was in Loma Linda Hospital. He did survive. Well, what did it mean to the movie theaters? The one singled out business. The Majestic Movie Theater and the Impress Movie Theater were the two that were quoted. And the manager of the Impress said, okay, you know, we're going to lose money, but we're going to do the right thing. A little bit later, particularly in the Los Angeles area, movie theater managers and owners were beginning to say, this isn't fair. You have left open all the businesses but ours. And why don't you either close everything but like grocery stores and drugstores? And they never did succeed in that. Why did Redlands suddenly take it seriously on October 14th? Well, there were beginning to be deaths in surrounding towns such as San Bernardino. And the first recorded case of a death in Redlands was on October 14th. Now, it was a 17-year-old. Remember that W, he was in that middle peak of the W. He had been in Texas and went to Chicago with cattle. Chicago was close to a great big naval training station on the Great Lakes with lots of flu. Somehow he got the flu there, took a train back to San Bernardino, and they said when he reached San Bernardino, he had no idea where he was. They brought him home to Redlands, where he died. And it kept coming. The population of Redlands in 1918 was about 10,000. By October 12th, that was before they closed things, there were about 150 cases. By November 5th, less than a month later, the cases had increased up to 467. And I could track 8 deaths in the October 12th to November 8th time period. It's hard to say how many cases day by day. It was kind of an inconsistent reporting. Okay, well, those were community mitigation things you could do. What about personal efforts at flu avoidance? They didn't know what viruses were, but they were aware that coughing, sneezing, and spitting seemed to be carrying this, whatever it was. And we don't talk about spitting a lot today, but it was a problem then. And I've taken some quotes out of a October 11th Daily Facts article where they were giving some health recommendations. And I thought the cover up each cough and sneeze, if you don't, you'll spread disease was an interesting way of putting it. And also your fate may be in your own hands. Wash your hands often. Again, this should sound really familiar. Masks. There were towns and cities that had mask rules, including San Francisco. I can't find evidence that Redlands itself required masks, but many places were using masks. They did not have access like we do today to all the different kinds of masks. They recommended gauze fabric, 4 to 6 layers, and you tie it on over your mouth and nose, as we keep stressing today. This photo I thought was interesting. It's a group of Red Cross volunteers making the masks, and they were actually making them for Camp Devens outside of Boston. And then they had to, again, explain to people, just as today, once you put the mask on, don't put your hands on it, don't handle it. And they recommended boiling it for 5 minutes and thoroughly drying it off. How do they treat the flu? Well, you'll notice that there's not a lot of things listed here. Again, there was no vaccine. There were efforts at vaccines. They didn't know what a virus was. They didn't have antibiotics. And the best thing that they could say was, when you started getting sick, go to bed and try to avoid the pneumonia that came as a secondary, often lethal part of it. And of course, there were people who were cashing in on influenza. With this one, Horlick's malted milk, if you drank it, then you would be healthier. What was the public health program in Redlands? Well, Dr. Talteval that I mentioned was the public health officer. There was a board of health as well with a doctor and some other individuals. Dr. Talteval was born in England. He was a naturalized US citizen, and he was trained at a reputable medical school, which was not always the case in this time period. And he gave a series of updates on a regular basis in the local paper, and often talking about number of cases, number of deaths, whether it was a mild, things were getting better, etc. And he was constantly gently encouraging people to be careful. Well, this is the second wave, and for Redlands, it starts in early October. Closings start the 14th of October, and then the reopenings start appearing as the number of cases start going down. By the 2nd of November, the businesses could stay open after 6, but still no gatherings. Schools reopened 3 weeks after they were closed on the 4th of November. As the number of cases really began to drop, public meetings were allowed on the 6th of November, and the churches finally reopened. But you'll notice, not the movie theaters. Was the flu really disappearing? Now, we call this the end of the second wave, but the people going through this had no idea that they were seeing waves and that there would be a third wave. On November 7th, with no new cases in the last 24 hours, the newspaper said things are getting really good. And then on November 11th, World War I ended, and spontaneous celebrations took place across the country as well as Redlands. And the newspaper said a seething mass of people showed up on the streets to celebrate in Redlands. And these people were no doubt not paying a bit of attention to social distancing or wearing masks, very few of them anyway. And whether or not they just gave up and opened the movie theaters, or whether they planned to open them, but on this evening when the war was declared over, the movie theaters were allowed to reopen. And this is an advertisement, came out November 12th. It came out the day after the opening. It's a World War I movie, which I thought was interesting. I haven't mentioned the University of Redlands. I was mentioning K through 12 public schools. University of Redlands was also opening and closing due to increasing and decreasing numbers of students. And I'm not going to mention any more than the fact that they seem to be on an opposite schedule many times of the town itself. On the 7th of October, before the 14th of October, when things closed down in Redlands, they closed the campus. They opened the campus back up the day after the public schools closed. Then they reopened them on the 4th of November. The campus reopened on the 4th of, they closed again on the 4th of November, the day that the public schools opened. And then they opened up again. So it wasn't really easy to follow some of that. Into the second wave, you're getting toward December. Were they flattening the curve or decreasing it? Well, the county hospital in San Bernardino superintendent said, looks like things are getting really good. Dr. Talteval said, well, the number of cases may go up and down. And then the third wave hit by early December. And this one for Redlands was as lethal as the second wave. And you have to think, not all cities went through a third wave. Not all of them were experiencing the same level of deaths and cases. But for Redlands, there were 12 deaths in the second wave. There were going to be 13 deaths in this third wave. And you can watch the total number of cases since the start go from 150 up to 991 by February 15th, which was really at the end of the third wave. So you've gotten into the third wave. People are dying. There's still very serious flu around. Was the town going to close down again? Well, on January 17th, there was a very interesting meeting. The Redlands Board of Health, the city trustees, which was like the it was the town board, and it was open to the public. There was a meeting, and overall, the decision was, we are not going to close things down right now. And you can imagine what the backlash would have been if they had closed it down again, because most people who have, like today, who have lived through being closed down, don't really want to go back to closures. So this meeting had several different people. One person stated, so the conclusion was kind of like, let's have a quarantine now instead of closing everything down. If you get sick, you go home and go to bed. But we don't want it to mess up the businesses. One of the physicians on the Board of Health said, well, this must have been a very interesting meeting. He says, sometimes people are infected before they show symptoms that would make them want to go home and go to bed. So there were pros and cons to this. But this third wave gradually began to dissipate. And by January 30th, Dr. Talteval said, Redlands, as well as much of Southern California, is beginning to disappear from it, out from under it. So 3 waves for Redlands, October 12th to about, in this case, these statistics go to February 9th. This is Redlands. What was the overall impact? Well, they reported 993 flu cases, but even in the newspapers of that time, it was felt that only about 50% of the cases were being reported. These weren't people who died. These were cases of the flu. So in the newspapers and elsewhere, they were saying, okay, if we had almost 1,000, we probably had 2,000 flu cases at least. Out of that, I've been able to find 25 flu deaths. There could be more in a town of about 10,000. So you have 25 deaths and 2,000 cases, then about 1.25% of those who got sick actually died. And worldwide, it was probably closer to 2.5%. So Redlands did better. But look at the fact that 0.1% death rate was what usually happened in flu pandemics. 2,000 cases, 10,000 people, about 20% of the population in Redlands got the flu. And worldwide, they think about a quarter of the world got this flu. Redlands did follow the national W curve for the ages of those who died. From the 25 that I had, I found 3 died who were under 5, 4 over 56, but look at the middle range. 72% of the flu deaths occurred from 17 to 44 years old. I'm just now beginning to put together some biographies of these people who died in Redlands, and I wanted to just highlight a few of them. There was a rancher, and by the way, when I say flu deaths from Redlands, at that time they included Yucaipa, Loma Linda, Redlands, all together as Redlands deaths. A man who was a rancher in Yucaipa, who was 36 years old, he died leaving a wife and 2 children also sick. And I haven't been able to find any statistics showing that they died. A 24-year-old pregnant woman died on Christmas Day, and it's strongly possible that she had actually lost her baby on December 17th from early labor induced by the flu. There was a woman who worked for the Harris store here in town, a woman who was assistant to the president of the Redlands National Bank, and another woman who worked at Union Savings Bank. All 3 of them also died, and they were in this age range. And it's interesting to note that those 3 were in jobs that put them in contact with probably a lot of people. Where were the 6 cared for in Redlands? Probably the bulk of them at home. Redlands Heights Sanitarium was established in July 1917. I thought it was interesting in their advertisements, no contagious diseases admitted, but I found 2 of the flu deaths happened there. There was an emergency hospital for those without much money, and it was at the Salvation Army Barracks here in town. Loma Linda Hospital, I don't have a lot of information on Redlands Hospital, but no doubt they too had flu. Who cared for them? Particularly the people without a lot of money in Redlands had help. There were doctors who were praised for their no-cost service, including Dr. Talteval. And note that this is a Redlands Daily Facts article of November 13th. This is at the end, this is getting toward the end of the second wave. The town thinks that they finished with the flu, and so they were praising people and thanking people for their help. Community contributions. Again, notice the top quote comes from that into the second wave. The townspeople gave money, blankets, bedding. I thought it was interesting, 75 gallons of soup. And then finally on February 5th, 1919, they were also thanking again when they were getting out of the third wave. Arabelle A. Webb should be very well noted in this town. She was the Associated Charities visiting nurse, and Associated Charities is now Family Services. She was 45 years old. She had 2 young daughters at home, and remember, there's little protective gear at this time. She probably was scared of infecting her 2 daughters. And by November 13th, she had seen an average of 10 patients a day, 118 altogether, probably a lot more. And she was the visiting nurse for low income. By February 5th, she'd seen another 132 patients. And nurses could make or break the health of some patients because bed rest, good food, that kind of help was necessary. Again, it was quoted, the thank yous were strong for her. They talked about how she nursed people with this awful pneumonia through. And then there was another nurse, Mary L. Saunders, who was very experienced. She had been the superintendent at Redlands Hospital in 1914, and she was the nurse in charge at the Red Cross Emergency Hospital at the Redlands Salvation Army Barracks. By November 1st, they were up and running. They'd had at least 16 cases. I did find one death that occurred at this particular hospital. Well, there are many, many questions from this incredibly lethal pandemic that are still under scrutiny, virologists, epidemiologists, historians. And in the last 10 years, I'd say there's been more and more and more research on this. Geographically, where did it come from? There are several possible locations. They're still working on that. Why were there 3 waves? They're still trying to figure that out. Why was it so lethal? Well, since this 1918, 1919 time period, they've actually, probably late 1990s, early 2000s, they replicated this particular flu and have tested it, and they're trying to find out what made it so lethal. And they actually used tissue from Army camp deaths, the patients. There were autopsies done of them. The tissue samples were saved. They were able to use some of the tissue samples to actually reproduce this flu, and also some bodies from the permafrost in the northern part of the world. Why did it hit that 20 to 35-year-old age range so badly? Definitely something they're still working on. And what happened to it after the winter of 1919? It did reappear. Now that they can identify the genetics of the virus, they can track it. And they've seen that for many, many years, it did come back in various mutated forms that were milder. Well, what are the similarities to today's pandemic? Quick spread worldwide. Community mitigation measures are so similar. As I was doing research on this early in the COVID-19 pandemic, I kept thinking, I've seen this before, and it was cover your mouth and nose, avoid crowds. Then we began closing the same places that they too had closed. And the personal hygiene, wash your hands. What do we have today that they did not have in 1918 to fight some of this? Well, we have a knowledge of viruses today. We're able to replicate the viruses in the laboratory, to do genetic testing on them, to find out what makes them lethal, what can we do, how can we develop vaccines. We can test to know if someone has COVID-19 or has had it. I think we take this for granted. This was not something around in 1918. We have knowledge of vaccines, and when everyone's waiting for a vaccine that will help, they were waiting for them during 1918 and 1919. And I mentioned that they thought several times they had it, and they would inoculate people and they weren't usable. Antibiotics. The antibiotics that we have today probably would have helped with some of the secondary infections like pneumonia. The first part of the second wave that hit the East Coast of the United States with the flu was so fast acting, killing people in 24, 48 hours, that it would have been very difficult even with antibiotics. We do have the ventilators in intensive care. We have better protective equipment. And something to keep in mind, if we close businesses and close schools, we have at least some ability to use the internet to keep teaching children and to keep our economy going. They did not have that choice. And then the flu pandemic began to fade, and it began to fade from memory as well. And I thought it was interesting that Dr. Talteval, January 30th, 1919, said, it will become only a memory. And in many cases, not only did it just become a memory, it actually disappeared. And there's a discussion, there's sort of a collective memory when you think of government and you know, teaching in the schools and things. It doesn't show up in our history books very much. Most of us didn't even learn about it when we were taking US history. However, individuals, if they were interviewed years later after the flu, vividly remembered what happened to them personally. The scientists didn't stop working on it, and they continued to work on all those, you know, those 5 questions I mentioned earlier. They're still working on them. And in researching the flu, there are many, many articles, particularly in the last 10 years or so, from the virologists, the epidemiologists, that are highly technical. Some of them are beginning now to mesh with the history writings, but these 3 that I have up here on the screen are general histories, one as early as 1976. Obviously, results since then are not included. 2004, a very classic work by John Barry on the flu pandemic, and then one in 2005 that looks specifically at army camps and the impact of the war and the flu. So in closing, I'd just like to mention that the influenza pandemic of 1918-1919 was extremely lethal, very memorable to the individuals who went through it.